There have been different studies, and this may be hard to qualify or quantify, but about 80 million people at any time are infected with HPV. Now, HPV, there's over 400 types. We usually think about 12 types that are high risk HPV, and those are the types that we test for, because those are the ones that, if they stick around long enough and those infections persist and progress, they are the ones that can cause precancerous and cancerous changes of the cervix, as well as other genitourinary areas and the oropharynx, so the throat as well. HPV can be prevented to an extent if during sex you use condoms or barriers, but really the protection rate is about 70 to 80%. And so even if you're doing due diligence to try to prevent against STIs, it's not an absolute. Other things that can be helpful are not smoking and drinking minimal alcohol. Those have also been shown to be risk factors in the persistence and then further development of HPV-related cancers.
To say one other thing, when we talk about vaccination, I want to make sure that it's completely clear that this is not only for women. This is a vaccination for both men and women. And so we really encourage this vaccination, again, ideally before they start their sexual intercourse activity. But again, it's something that we propose at the age of 9 to 11 for their first doses, but it's both for boys and girls.